Hello and welcome to my channel Empowering Aesthetic Excellence. I'm Dr. Bhavna Agarwal, facial aesthetic consultant, aesthetic physician, and a beauty psychologist. So these are a series of videos which I am doing in the series Eyes and Periorbital Rejuvenation. And this is the fifth video in the series. Now, in the previous video, we had discussed how to go about and bring about a lateral brow lift using only the orbicularis oculi muscle, the upper lateral fibers. It is best suited for young individuals in which there are no other signs of aging or wrinkles in and around that area. Now, this is the second variant that we are discussing in this video, which is the lateral brow lift with the neurotoxin using the muscle frontalis, which means that what you will observe is that you will inject the neurotoxin to lift the eyebrows using the muscle frontalis. Now, what will you observe in the pre-assessment is that besides a brow droop, which may or may not be associated with upper eyelid hooding, there might be presence of some dynamic forehead wrinkles, horizontal and vertical. There might be presence of crow's feet, etc., around those area. So the only prerequisite in this technique is there should be absence of temporal hollowness. Not that if temporal hollowness is present, you wouldn't attempt it, but if at all you do it in the presence of temporal hollowness, then a brow lift will be achieved, but there might be an additional wrinkle that develops in the lateral lower forehead, which might not be present earlier. So that is the only disadvantage of this technique if done in the presence of temple hollowness. Now, the frontalis muscle, as we know, is generally responsible for lifting the eyebrow. And therefore, when the frontalis muscle or forehead is not treated, the entire forehead, has the capacity to lift. But when we want to achieve a lateral brow lift, what we are trying to attempt is a differential lifting capacity of the lateral and medial fibers of frontalis, such that when it comes into action, or when the eyebrows are raised, and when the frontalis is contracted, the lateral lift supersedes the medial lift. That means the lateral lift is more as compared to the medial lift. Now, this is only possible by the clever manipulation of the dosage of the neurotoxin and the pattern in which it is injected in the frontalis muscle. So we all know that frontalis muscle has medial fibers which lift the medial eyebrows and the lateral fibers which lift the lateral eyebrows. Now, how do we cleverly manipulate the dose? So by clever manipulation, we mean that the upper central fibers are injected with the normal dose of neurotoxin to help them retain a mild lifting effect, whereas the upper lateral fibers are injected in a way that is they're underdosed to retain a moderate lifting effect. So if you imagine the forehead divided into 12 quadrants with these imaginary lines, then the upper central fibers, that is F2, F3, F6, and F7, these areas are injected with neurotoxin at a normal dose. The dose that you can decide according to the techniques you follow, according to the muscle strength, muscle activity, etc., and the intensity of the wrinkles in these areas. But the upper lateral fibers, that is the quadrant F5 and F8, are injected at a lower dose as compared to the dose injected in the central medial fibers. So this is how an intentional lifting effect is created. The quadrant F1 and F4 are not required because these are too high, and the lower quadrants F9, 10, 11, and 12 are not injected to avoid any kind of brow drooping. Now, this gives, when you once injected using this method, it gives an illusion of a brow lift laterally, and it can be described as intentional lifting. Now, the clever manipulation of pattern, we mean that using an M-shaped injection pattern will manipulate the power of forehead or frontalis to cause a brow lift. That is, choosing the injection points in such a way that the laterally we have just 1 or 2 points, and medially we have more concentration of points. And the key here is getting the dose right. So the dosage and injection technique and depth used for brow lifting with neurotoxin, it may vary depending upon the patient's facial anatomy, muscle strength, and desired outcomes. So when you assess, you see the density or intensity of the wrinkles, you decide your dosages, and then you fix the pattern in which you will inject. Now, the key point here to understand is that there is a thin line difference between intentional brow lifting and intentional spocking. So in intentional lifting, that is brow lifting, there's a slight arch, between the medial 2/3 and the lateral 1/3 of the eyebrow. That is, the tail of the eyebrow is slightly arched. Whereas spocking occurs when the anti-wrinkle product, whereas spocking will occur when there is an angulation a sharp angulation between the medial 2/3 and lateral 1/3 of the eye. That means spocking will occur when the anti-wrinkle product is concentrated too centrally, leaving the outer aspects of the elevator muscle of the forehead completely active. So this will result in no movement in the middle forehead, whereas the normal movement or maybe overactivity in the outer aspects, causing a raised or spocked brow. So this is how an intentional spocking would be. The only difference is that the quadrants F5 and F8 are not treated, and the medial quadrants, these 4 quadrants, F2, F3, F6, and F7, are normally treated or over-treated. So this will result in an intentional spocking. So this is how the intentional spocking looks like. Now, the strategic dosing of neurotoxin in the frontalis is that for intentional lifting, there is normal dosing of upper medial fibers and underdosing of upper lateral fibers. And for intentional spocking, there is overdosing or normal dosing of the upper medial fibers and complete avoidance of the upper lateral fibers. So as medical aesthetic practitioners, you want to remain safe and provide effective treatments that achieve your patient's goals, which means that under-treating by using conservative dosing in the first appointment, and you can always retreat at the follow-up visit or a review visit 2 weeks after their initial treatment. And once you see how your patients respond and understand the result they're looking for, you'll know better for the next time. And always take a cautious approach, a conservative approach in toxin dosing, especially with new patients whom you are injecting for the first time. Now, one thing which is very peculiar about this brow lifting variant 2 is that when you do this with neurotoxin, that at rest, when the muscle is at rest, the difference is not as much appreciable. The brow lifting effect is minimal. But as soon as you put the muscle into action, it becomes very obvious. So the result becomes, outblown when the muscle is brought into action. So this may or may not be sometimes problematic with certain individuals. So I hope this video has helped to understand you the concepts and the principles of the brow lifting when you are injecting individuals above the age of 40, 45. And as much as convoluted topic this is, I'm sure it must be difficult for you sometimes to assimilate it. So I would request you to watch this video again and again to understand the principles and the concepts. And if you have any doubts, queries, or questions, do share in the comments below. And for more clarity on this topic, like if something is not clear to you, I'm always available on the number given below. So thank you for watching, and see you in the next video.